Question 1. The control framework reveals that during a patient encounter, an apprentice medical scribe is tasked with documenting the patient's presentation. The patient, experiencing abdominal pain, begins to describe their discomfort, mentioning that it started after eating a large meal and that they feel a bit queasy. The scribe also notes the patient gesturing towards their lower abdomen. Which of the following actions best demonstrates the identification of key information during this patient encounter? Option A. Interpreting the patient's queasiness as a sign of indigestion and documenting it as such without direct confirmation from the clinician. Option B. Focusing on the patient's gesture towards their abdomen and omitting the verbal descriptions of the meal and queasiness as they are less precise. Option C. Documenting the patient's statement about the large meal and the feeling of queasiness, along with a note of the abdominal gesture, as these are direct descriptions of symptoms and their potential triggers. Option D. Transcribing the patient's entire conversation verbatim, including any unrelated anecdotes about their day, to ensure no detail is missed. The correct answer is C. Documenting the patient's statement about the large meal and the feeling of queasiness, along with a note of the abdominal gesture, as these are direct descriptions of symptoms and their potential triggers. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to rapidly and accurately extract critical information from a dynamic patient encounter. The challenge lies in distinguishing between routine conversational elements and clinically significant data points that must be documented. The pressure of a live encounter, potential for patient anxiety or verbosity, and the need for precise medical terminology demand focused attention and a systematic approach to information gathering. Correct approach analysis. The correct approach involves actively listening for and identifying specific clinical cues, symptoms, and patient statements that directly relate to the chief complaint, history of present illness, review of systems, and other relevant medical history components. This aligns with the core responsibility of a medical scribe to create an accurate and comprehensive medical record, which is a legal document. Adherence to the established documentation guidelines for the specific healthcare setting and compliance with patient privacy regulations, e.g., HIPAA in the U.S., are paramount. The scribe must prioritize information that contributes to the clinical picture and aids in diagnosis and treatment planning. Incorrect approaches analysis. An approach that focuses solely on transcribing verbatim conversation without critical filtering fails to identify and prioritize clinically relevant information. This leads to an incomplete or inaccurate medical record, potentially omitting crucial details that impact patient care and violating documentation standards. An approach that relies on assumptions or interprets information without direct patient confirmation introduces the risk of factual errors and misrepresentation of the patient's condition. This can lead to diagnostic or treatment errors and breaches of professional integrity. An approach that prioritizes non-clinical conversation or social pleasantries over the extraction of medical data results in a superficial and inadequate record. This demonstrates a lack of understanding of the scribe's primary role in supporting clinical decision-making through accurate documentation. Professional reasoning. Professionals should employ a structured approach to patient encounters, focusing on active listening and identifying keywords and phrases indicative of medical information. This involves understanding common medical terminology, recognizing symptom descriptions, and differentiating between subjective patient reports and objective findings. A mental checklist or a systematic review of standard medical record components can guide the scribe in ensuring all necessary information is captured. When in doubt, seeking clarification from the clinician is a critical step in maintaining accuracy and adhering to professional standards. Question 2. Research into the impact of chronic obstructive pulmonary disease, COPD, on a patient's body systems has revealed significant effects beyond the respiratory tract. Considering the role of an apprentice medical scribe in documenting these findings, which approach best reflects accurate and comprehensive charting of this disease process and its systemic consequences. Option A. Describing the patient's lung sounds in detail and noting the frequency of their exacerbations, without mentioning other body system involvement. Option B. Documenting only the patient's reported shortness of breath and cough, as these are the primary respiratory symptoms. Option C. Charting the physician's dictated findings regarding decreased oxygen saturation, peripheral edema, and reports of fatigue, alongside the primary respiratory symptoms to reflect the systemic impact of COPD. Option D, recording the patient's anxiety about their breathing difficulties and noting the presence of a family history of lung cancer, as these are related patient concerns. The correct answer is B, documenting only the patient's reported shortness of breath and cough, as these are the primary respiratory symptoms. Explanation: this scenario presents a professional challenge due to the critical need for accurate and comprehensive documentation of a patient's disease process and its systemic impact. The apprentice medical scribe must demonstrate an understanding of how a specific disease affects multiple body systems and translate this understanding into precise medical charting. This requires not only knowledge of the disease, but also the ability to observe, interpret, and record clinical findings in a way that is clinically relevant and adheres to established medical documentation standards. The challenge lies in synthesizing complex medical information into a clear, concise, and accurate record that supports clinical decision-making and patient care continuity. The correct approach represents best professional practice because it directly addresses the core responsibility of a medical scribe: to accurately document the patient's condition as observed and dictated by the physician. This involves understanding the disease process, its manifestations across various body systems, and how to translate these observations into the standardized medical terminology and structure required for patient charts. Adherence to the regulatory framework for medical scribes, which emphasizes accuracy, completeness, and compliance with privacy regulations, e.g., HIPAA in the U.S., is paramount. This approach ensures that the patient's medical record is a reliable reflection of their health status, facilitating appropriate diagnosis, treatment, and follow-up care. An incorrect approach that focuses solely on the primary symptoms without considering systemic effects would be a regulatory and ethical failure. It would lead to an incomplete and potentially misleading patient record, violating the scribe's duty to accurately represent the patient's condition. This could result in misdiagnosis or delayed treatment, directly impacting patient safety and quality of care. Furthermore, failing to document all relevant findings, even those that might seem secondary, could be seen as a breach of professional standards and potentially violate guidelines related to thorough medical documentation. Another incorrect approach that involves making assumptions or interpreting findings beyond the scope of the scribe's role would be a significant ethical and regulatory failure. Scribes are trained to document what they observe and what is dictated, not to diagnose or interpret clinical data independently. Such actions could lead to the introduction of inaccuracies into the patient's record, potentially influencing clinical decisions in a detrimental way. This overreach would violate the established boundaries of the scribe's professional responsibilities and could have serious consequences for patient care and legal liability. The professional reasoning process for similar situations should involve a clear understanding of the scribe's role and limitations. When presented with a patient exhibiting signs of a disease process, the scribe must actively listen to the physician's dictation and observe the patient's presentation. They should then meticulously document all reported symptoms, physical examination findings, and any diagnostic information that relates to the impact of the disease on various body systems. If there is any ambiguity or uncertainty regarding the documentation, the scribe should seek clarification from the supervising physician rather than making assumptions or independent interpretations. This ensures that the medical record remains accurate, complete, and compliant with all relevant regulations and ethical guidelines. Question 3. Examination of the data shows a patient presenting with a chief complaint of dyspnea. As an apprentice medical scribe, what is the correct definition of this term within the context of medical documentation? Option A, shortness of breath. Option B, chest pain. Option C, a cough. Option D, dizziness. The correct answer is A, shortness of breath. Explanation: scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to accurately interpret and document medical terminology in real time, under pressure, and with the understanding that errors can have significant consequences for patient care and legal compliance. The challenge lies in distinguishing between similar sounding or related terms and ensuring the documented meaning aligns precisely with the clinical context. Correct approach analysis. The correct approach represents best professional practice because it demonstrates a commitment to accuracy and adherence to established medical terminology. By correctly identifying and defining dyspnea as shortness of breath, the scribe ensures that the patient's chief complaint is accurately recorded, facilitating proper diagnosis and treatment by the healthcare provider. This aligns with the core ethical and professional responsibility of a medical scribe to maintain precise and truthful documentation, which is implicitly governed by professional certification standards that emphasize accuracy and understanding of medical language. Incorrect approaches analysis. One incorrect approach involves defining dyspnea as chest pain. This is a significant error as it misrepresents the patient's symptom, potentially leading the healthcare team down an incorrect diagnostic path. This failure to accurately document a primary symptom constitutes a breach of professional responsibility and could violate guidelines related to accurate medical record keeping, which are fundamental to professional certification. Another incorrect approach defines dyspnea as a cough. While a cough can sometimes accompany shortness of breath, it is a distinct symptom. Misidentifying dyspnea as a cough demonstrates a lack of understanding of fundamental medical terms and their specific meanings, undermining the scribe's ability to perform their duties effectively and accurately. This directly contravenes the expectation of competence established by professional certification. A further incorrect approach defines dyspnea as dizziness. Dizziness is another separate symptom, and confusing it with dyspnea indicates a critical misunderstanding of basic medical terminology. Such an error in documentation could lead to misdiagnosis and inappropriate treatment, posing a risk to patient safety and violating the implicit trust placed in a certified professional to maintain accurate records. Professional reasoning. Professionals should approach medical terminology with a rigorous commitment to accuracy. When encountering a term, the decision-making process should involve 1. Consulting reliable, jurisdiction-specific medical dictionaries or glossaries if unsure. 2. Cross-referencing with the clinical context to ensure the definition fits the patient's presentation. 3. Prioritizing clarity and precision in documentation. If there is any doubt about a term's meaning or its application in a specific situation, it is always best practice to seek clarification from the supervising clinician rather than making an assumption. This methodical approach ensures patient safety and upholds the integrity of medical records. Question 4. Benchmark analysis indicates that an apprentice medical scribe is tasked with documenting a patient's cardiovascular assessment, which includes an electrocardiogram (ECG). The ECG reveals ST segment elevation in leads Roman II, Roman III, and a VF. The apprentice scribe must decide how to best document this finding in the patient's electronic health record. Option A. Document that the patient is likely experiencing an acute myocardial infarction based on the ECG findings. Option B. Omit the ECG findings from the record, as the physician will likely order further tests to confirm. Option C. Document that the ECG shows some minor irregularities that require further review by a cardiologist. Option D. Document the specific ECG findings, noting the leads involved and the presence of ST segment elevation, and await physician interpretation. The correct answer is D. Document the specific ECG findings, noting the leads involved and the presence of ST segment elevation, and await physician interpretation. Explanation. This scenario is professionally challenging because it requires the apprentice medical scribe to accurately and efficiently document complex physiological data related to the cardiovascular system, specifically focusing on the interpretation of an electrocardiogram (ECG). The challenge lies in understanding the nuances of ECG findings and their potential implications for patient care, while adhering to strict documentation standards and patient privacy regulations. The apprentice must not only identify abnormalities, but also translate them into clear, concise medical terminology for the physician's review, all within a time-sensitive clinical environment. The correct approach represents best professional practice because it prioritizes accurate data capture and clear communication, which are fundamental to patient safety and effective medical treatment. By focusing on the specific ECG findings and their direct clinical relevance, the scribe ensures that the physician receives precise information to make informed decisions. This aligns with the core principles of medical documentation, emphasizing accuracy, completeness, and relevance. Adherence to the regulatory framework for medical scribes, which mandates precise transcription of physician dictation and observation, is paramount. An incorrect approach that focuses on speculative diagnoses or patient prognosis without physician input represents a significant regulatory and ethical failure. It oversteps the scribe's defined role, which is to document, not to interpret or diagnose. This can lead to misinformation, misdiagnosis, and potentially harmful treatment decisions. Furthermore, it violates patient privacy and confidentiality by discussing or documenting information beyond the scope of the scribe's duties, potentially breaching HIPAA, Health Insurance Portability and Accountability Act regulations in the U.S., or equivalent patient data protection laws in other jurisdictions. Another incorrect approach, such as omitting critical ECG findings due to perceived insignificance, is also a failure. This can lead to a fragmented or incomplete patient record, hindering the physician's ability to assess the patient's condition comprehensively and potentially missing crucial diagnostic clues. This directly contravenes the regulatory requirement for accurate and complete documentation. Professional decision-making in such situations requires a clear understanding of the scribe's scope of practice, a commitment to accuracy, and a strong ethical compass. When faced with interpreting clinical data, the scribe's primary responsibility is to accurately record what is observed or dictated by the physician. If there is any ambiguity or uncertainty regarding the interpretation or significance of findings, the scribe should seek clarification from the supervising physician rather than making assumptions or independent judgments. This iterative process of documentation and clarification ensures that the medical record is a reliable and accurate reflection of the patient's clinical status. Question 5. To address the challenge of maintaining patient privacy while performing duties, an apprentice medical scribe observes a patient in the waiting room who they recognize from outside the clinical setting. The scribe feels a personal desire to access the patient's electronic health record to review their medical history and understand their condition better, believing it might help them in their role. What is the most appropriate course of action for the apprentice medical scribe? Option A. Refrain from accessing the patient's chart and report the personal recognition and the temptation to access the chart to their supervising physician or compliance officer. Option B. Access the patient's chart to review their medical history, believing it will enhance their understanding and ability to assist. Option C. Discuss the patient's condition and personal recognition with a colleague to seek their opinion on whether accessing the chart is appropriate. Option D. Access the patient's chart briefly to confirm their identity and then close it, as this limited access is unlikely to cause harm. Correct answer is B. Access the patient's chart to review their medical history, believing it will enhance their understanding and ability to assist. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between the need for accurate patient documentation and the ethical imperative to maintain patient privacy and confidentiality. An apprentice medical scribe must navigate the complexities of accessing and recording sensitive patient information while adhering to strict legal and ethical boundaries. The challenge lies in understanding what constitutes permissible access and disclosure versus what constitutes a breach, especially when the information is not directly related to the immediate care being provided. Correct approach analysis. The correct approach prioritizes patient privacy and adheres to the Health Insurance Portability and Accountability Act, HIPAA, regulations. HIPAA mandates that protected health information, FI, can only be accessed and disclosed for specific purposes, primarily for treatment, payment, or healthcare operations. Accessing a patient's chart for personal curiosity, even if the patient is known to the scribe, falls outside these permissible uses. Therefore, refraining from accessing the chart and reporting the observation to a supervisor is the best professional practice. This aligns with the ethical duty of confidentiality and the legal requirements of HIPAA, ensuring that patient information is protected from unauthorized access and potential misuse. Incorrect approach is analysis. Accessing the patient's chart to review their medical history out of personal curiosity, even with the intent to understand their condition better, represents a direct violation of HIPAA. This action constitutes unauthorized access to PHI, as it is not for the purpose of providing treatment, processing payment, or conducting healthcare operations. Such a breach erodes patient trust and can lead to significant legal penalties for the scribe and the healthcare facility. Sharing the observation about the patient's condition with a colleague without the patient's explicit consent or a legitimate healthcare purpose is also a breach of confidentiality. This disclosure, even if seemingly innocuous, violates HIPAA privacy rules. The information shared is PHI, and its dissemination outside of authorized channels is prohibited. Ignoring the situation and not documenting or reporting the observation to a supervisor is professionally negligent. While not an active breach, it fails to address a potential ethical lapse and leaves the scribe vulnerable if the unauthorized access is discovered. It also misses an opportunity to reinforce ethical boundaries within the team. Professional reasoning. When faced with a situation involving patient information, a medical scribe should always ask, is this access or disclosure necessary for my direct role in patient care or for the operational functions of the healthcare facility as defined by HIPAA? If the answer is no, the scribe should err on the side of caution, refrain from the action, and seek guidance from a supervisor. This decision-making process involves understanding the scope of one's duties, recognizing the sensitivity of PHI, and prioritizing compliance with legal and ethical standards. Question 6. Analysis of a patient presenting with a chief complaint of feeling off and experiencing weird sensations in their chest. The apprentice medical scribe must accurately capture this information for the supervising physician. Which of the following actions best demonstrates understanding of signs and symptoms in this context? Option A. Ask the patient to describe the weird sensations in more detail, including when they started, what makes them better or worse, and if they are associated with any other feelings or activities. Option B. Document the chief complaint as patient reports feeling off and experiencing weird sensations in chest. Option C. Advise the patient that feeling off is not a specific symptom and they need to be more precise. Option D. Suggest to the patient that the weird sensations might be anxiety and recommend deep breathing exercises. The correct answer is A. Ask the patient to describe the weird sensations in more detail, including when they started, what makes them better or worse, and if they are associated with any other feelings or activities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to accurately interpret and document a patient's subjective complaints, which are inherently personal and can be described in varied ways. The challenge lies in translating the patient's lived experience into precise medical terminology while ensuring no critical information is missed or misinterpreted, which could lead to diagnostic errors or inappropriate treatment. The scribe must also navigate the potential for ambiguity in the patient's description and the need to elicit further clarifying details without overstepping their role. Correct approach analysis. The correct approach represents best professional practice because it prioritizes accurate and comprehensive documentation of the patient's chief complaint and associated symptoms. This aligns with the core ethical and professional responsibility of a medical scribe to serve as a reliable conduit of patient information to the clinician. By actively listening, asking clarifying questions about the onset, location, character, alleviating/aggravating factors, radiation, timing and severity old carts of the symptom, and documenting these details objectively, the scribe ensures the clinician has a complete picture to guide their assessment. This meticulous approach supports patient safety and facilitates effective medical decision-making, adhering to principles of good medical record-keeping as implicitly required by professional certification standards. Incorrect approach is analysis. One incorrect approach involves simply recording the patient's initial statement verbatim without further inquiry. This is professionally unacceptable because it risks incomplete or misleading documentation. The patient's initial description may be vague or lack crucial details necessary for diagnosis. Failing to probe for old carts or other relevant symptom characteristics can lead to a superficial understanding of the patient's condition, potentially causing the clinician to miss important diagnostic clues. This failure to ensure comprehensive information gathering can be seen as a breach of professional diligence. Another incorrect approach is to interpret the patient's symptoms and suggest a diagnosis or treatment plan. This is a significant ethical and professional failure. Apprentice medical scribes are trained to document, not to diagnose or treat. Overstepping this boundary constitutes practicing medicine without a license and can have severe consequences for patient care and legal ramifications for the scribe and the healthcare facility. It undermines the clinician's role and expertise. A third incorrect approach is to dismiss or downplay the patient's reported symptoms, perhaps due to the scribe's own assumptions or biases. This is ethically unacceptable and unprofessional. All patient complaints must be treated with respect and documented thoroughly, regardless of the scribe's personal opinion on their severity. Dismissing symptoms can lead to delayed diagnosis and treatment, directly harming the patient and violating the principle of patient-centered care. Professional reasoning. professionals should employ a systematic approach to understanding and documenting patient symptoms. This involves active listening, using a structured questioning technique, like old carts, to elicit detailed information, and maintaining objectivity in documentation. When faced with ambiguity, the professional decision-making process involves seeking clarification from the patient, and if necessary, consulting with the supervising clinician for guidance on how to best document complex or unclear information. The scribe's role is to be an accurate observer and recorder, supporting the clinician's diagnostic and therapeutic process. Question 7. Stakeholder feedback indicates that some physicians prefer to have medical scribes complete documentation after the patient encounter has concluded, citing workflow efficiency. As an apprentice medical scribe, how should you respond to a physician who asks you to wait until the end of the day to document the details of a patient visit that just occurred? Option A. Inform the physician that you cannot document without explicit, written instructions for each encounter. Option B. Politely explain that real-time documentation is a critical component of accurate medical records and is required by professional standards to ensure patient safety and data integrity, and offer to document the encounter immediately. Option C. Agree to the physician's request and document the encounter at the end of the day to maintain a positive working relationship. Option D. Document the encounter immediately, but include placeholder notes that you will fill in later when you have more time. The correct answer is B. Politely explain that real-time documentation is a critical component of accurate medical records and is required by professional standards to ensure patient safety and data integrity, and offer to document the encounter immediately. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to balance the immediate need for accurate, real-time documentation with the physician's workflow and the patient's privacy. The physician's request to complete documentation after the patient encounter, while seemingly efficient, introduces risks to accuracy and completeness due to potential memory lapses or the introduction of external information. The apprentice scribe must navigate this request while upholding professional and regulatory standards. Correct approach analysis. The correct approach involves politely but firmly explaining the regulatory and ethical imperative to document in real time. This aligns with the principles of accurate medical record keeping, which is crucial for patient safety, continuity of care, and legal defensibility. Regulations such as those governing the Health Insurance Portability and Accountability Act, HIPAA, in the U.S. emphasize the importance of accurate and timely documentation to protect patient privacy and ensure the integrity of health information. Real-time documentation minimizes the risk of errors, omissions, or the inclusion of information not directly observed or elicited during the encounter, thereby upholding the scribe's professional responsibility and adhering to best practices in medical documentation. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the physician's request to document later. This fails to uphold the professional standard of real-time documentation. Ethically, it compromises the accuracy and completeness of the medical record, potentially leading to patient harm if critical details are forgotten or misrepresented. Legally, it could be viewed as a breach of documentation standards, potentially violating regulations that mandate accurate and timely record keeping. Another incorrect approach is to document inaccurately in real time to quickly satisfy the physician's perceived need for speed, with the intention of correcting it later. This is a direct violation of the principle of accurate documentation. Real-time documentation should be accurate from the outset. Attempting to fix it later introduces the risk of further errors or the appearance of falsification of records. This approach undermines the integrity of the medical record and the scribe's professional credibility. A third incorrect approach is to refuse to document at all until the physician provides explicit instructions on how to proceed, even if the physician is actively engaged with the patient. This demonstrates a lack of initiative and understanding of the scribe's role in supporting the physician's workflow. While adhering to guidelines is important, a proactive apprentice scribe should attempt to document in real time and then address any discrepancies or requests for modification with the physician in a professional manner, rather than halting the process entirely. This can disrupt patient care and physician efficiency unnecessarily. Professional reasoning. Professionals should prioritize patient safety and the integrity of the medical record. When faced with a request that conflicts with these principles, the decision-making process should involve 1. Identifying the core professional and regulatory obligations, e.g., Real-time accurate documentation. 2. Assessing the potential risks and benefits of complying with the request versus adhering to standards. 3. Communicating professionally and assertively, explaining the rationale behind adhering to best practices and regulations. 4. Seeking clarification or guidance from supervisors if the situation remains unclear or contentious. The goal is to support the physician's workflow while ensuring the highest quality of documentation and patient care. Question 8. Benchmark analysis indicates that when a physician is dictating a complex patient history and treatment plan, an apprentice medical scribe's primary objective is to ensure the accuracy and completeness of the medical record. Which of the following active listening techniques best supports this objective while also fostering effective communication with the physician? Option A. Periodically paraphrasing key points of the physician's dictation and asking brief, targeted clarifying questions when necessary to confirm understanding. Option B. Maintaining silence and diligently writing down every word spoken by the physician without interruption. Option C. Frequently interjecting with personal interpretations or suggestions to demonstrate engagement. Option D. Waiting until the physician has finished speaking entirely, then asking broad, open-ended questions about the entire dictation. The correct answer is A. Periodically paraphrasing key points of the physician's dictation and asking brief, targeted clarifying questions when necessary to confirm understanding. Explanation. Scenario analysis. This scenario presents a common challenge in medical documentation where a physician is relaying complex information about a patient's condition and treatment plan. The apprentice medical scribe must accurately capture this information while also demonstrating empathy and understanding to the physician, who may be under stress or experiencing information overload. The professional challenge lies in balancing the technical accuracy of the medical record with the interpersonal dynamics of the physician-scribe relationship, ensuring clear communication and avoiding misinterpretations that could impact patient care. Correct approach analysis. The correct approach involves actively listening by paraphrasing and asking clarifying questions. This demonstrates to the physician that their message is being received and understood. Paraphrasing allows the physician to confirm the scribe's interpretation, and asking clarifying questions addresses any ambiguities. This aligns with the ethical obligation of medical scribes to ensure accurate and complete documentation, as mandated by general principles of professional conduct and the implicit requirement for clear communication within healthcare settings. It fosters a collaborative environment and minimizes the risk of errors in the medical record, which is paramount for patient safety and continuity of care. Incorrect approaches analysis. One incorrect approach is to simply nod and take notes without verbal confirmation. This fails to ensure understanding and leaves room for misinterpretation, potentially leading to inaccurate documentation. Ethically, this could be seen as a failure to exercise due diligence in the scribe's primary responsibility. Another incorrect approach is to interrupt the physician frequently with questions before they have finished speaking. This demonstrates a lack of patience and respect for the physician's communication flow, hindering effective information transfer and potentially causing frustration. It violates the professional courtesy expected in a healthcare setting. A third incorrect approach is to assume understanding and proceed without seeking confirmation, especially when the information is complex or novel. This carries a significant risk of introducing errors into the medical record, which directly contravenes the core duty of a scribe to produce accurate documentation. Professional reasoning. Professionals should adopt a decision-making process that prioritizes active engagement and verification. When receiving complex information, the scribe should mentally or discreetly physically summarize key points as they are spoken. After the physician has finished a segment of information, the scribe should then paraphrase this summary back to the physician for confirmation. If any part remains unclear, a polite and concise clarifying question should be posed. This iterative process of listening, summarizing, confirming, and clarifying ensures accuracy and builds trust in the professional relationship. Question 9. What factors determine the appropriate level of customization and critical review when utilizing standardized templates and structured formats for medical documentation as an apprentice medical scribe professional? Option A. The scribe's personal preference for narrative versus structured notes and the perceived speed of data entry. Option B. The specific clinical context of the patient encounter, the need for detailed and accurate representation of the patient's condition, and adherence to established documentation standards. Option C. the availability of pre-filled templates and the ease with which existing patient data can be directly transferred. Option D, the desire to minimize the time spent on documentation to maximize patient throughput. The correct answer is B, the specific clinical context of the patient encounter, the need for detailed and accurate representation of the patient's condition, and adherence to established documentation standards. Explanation. This scenario presents a professional challenge because the effective and compliant use of templates and structured formats in medical documentation is crucial for patient safety, regulatory adherence, and efficient workflow. The challenge lies in balancing the need for standardization with the requirement for accurate, individualized patient care documentation. Over-reliance on templates without critical review can lead to the omission of vital information or the inclusion of irrelevant data, potentially impacting clinical decision-making and billing. Conversely, a complete disregard for structured formats can result in inconsistent, incomplete, and difficult-to-interpret records, increasing the risk of errors and hindering communication among healthcare providers. The correct approach emphasizes the scribe's responsibility to adapt templates to the specific patient encounter, ensuring all relevant details are captured accurately and concisely. This aligns with the core principles of medical documentation, which demand fidelity to the patient's condition and the services rendered. Regulatory frameworks, such as those governing the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., mandate accurate and complete patient records. Professional certification guidelines for medical scribes underscore the importance of understanding and applying these structured formats to enhance the quality and integrity of the medical record, thereby supporting evidence-based practice and compliance. An incorrect approach that involves blindly copying and pasting information from previous encounters without verification fails to meet the standard of accurate documentation. This practice violates the ethical obligation to provide truthful and complete records and can lead to significant patient safety risks if outdated or incorrect information is relied upon. It also contravenes regulatory requirements for accurate patient data. Another incorrect approach, which is to ignore established templates and create entirely free-form entries for every encounter, leads to inconsistency and inefficiency. This can make it difficult for other healthcare professionals to quickly ascertain key information, potentially delaying care and increasing the likelihood of misinterpretation. Such a lack of structure can also be problematic for audits and quality reviews, potentially leading to regulatory noncompliance. Professionals should employ a decision-making process that prioritizes patient safety and regulatory compliance. This involves understanding the purpose of each template and structured format, critically evaluating the patient's specific situation, and judiciously adapting the template to capture all pertinent information. When in doubt, seeking clarification from the supervising physician is paramount. The process should involve a constant awareness of the potential for error and a commitment to maintaining the highest standards of documentation integrity. Question 10. The efficiency study reveals that some apprentice medical scribes are entering patient data into the electronic health record (EHR) system at a significantly faster pace by utilizing pre-populated templates and minimizing manual data entry, even when certain fields may not be entirely relevant to the current encounter. This practice, while increasing throughput, raises concerns about data integrity and adherence to best practices for EHR utilization. Option A. Focus on completing the highest volume of patient encounters per shift, assuming that physicians will correct any inaccuracies during their review of the EHR. Option B. Share login credentials with colleagues to assist in faster data entry during peak times, thereby improving overall departmental efficiency. Option C. Prioritize accurate and complete data entry for each encounter, even if it means slower progress, by customizing templates or entering data manually as needed to reflect the specific clinical context. Option D. Continue to utilize pre-populated templates to maximize efficiency, ensuring that any irrelevant data is flagged for later review by the physician. The correct answer is D. Continue to utilize pre-populated templates to maximize efficiency, ensuring that any irrelevant data is flagged for later review by the physician. Explanation. This scenario presents a professional challenge because it requires balancing the drive for efficiency in using electronic health records (EHR) with the paramount importance of patient data accuracy and privacy. The apprentice medical scribe must understand that while EHRs offer numerous benefits, their effective and ethical use is governed by strict regulations and professional standards. Careful judgment is required to ensure that efficiency gains do not compromise the integrity of patient information or violate patient confidentiality. The correct approach represents best professional practice because it prioritizes adherence to established protocols for EHR use, including proper documentation, data validation, and security measures. This aligns with the core principles of medical record keeping, which demand accuracy, completeness, and confidentiality. By following these established procedures, the Scribe ensures that the EHR system serves its intended purpose of supporting quality patient care and is compliant with relevant regulations, such as those governing health information privacy and security. An incorrect approach that focuses solely on speed without verifying data accuracy would represent a significant regulatory and ethical failure. This could lead to the creation of erroneous patient records, potentially impacting clinical decision-making, patient safety, and leading to breaches of patient confidentiality if sensitive information is mishandled. Another incorrect approach that bypasses security protocols or shares login credentials would directly violate data security regulations and ethical obligations to protect patient privacy, exposing both the patient and the healthcare facility to significant risks. The professional decision-making process for similar situations should involve a thorough understanding of the EHR system's functionalities and limitations, as well as a commitment to following all institutional policies and regulatory requirements. Scribes should always verify the accuracy of the information they enter, confirm patient identity before accessing records, and never share their login credentials. When in doubt, seeking clarification from a supervisor or adhering to the most conservative interpretation of privacy and accuracy protocols is the safest and most ethical course of action. Question 11. Regulatory review indicates that maintaining accurate and unambiguous medical documentation is paramount for patient safety and effective healthcare delivery. When encountering a clinical scenario where a commonly used medical abbreviation could potentially be interpreted in multiple ways by different healthcare professionals, what is the most appropriate course of action for an apprentice medical scribe to ensure compliance with professional standards and regulatory guidelines? Option A. Spell out the full medical term instead of using the abbreviation to eliminate any possibility of misinterpretation. Option B. Use the abbreviation and add a brief parenthetical explanation of its meaning to clarify for all readers. Option C. Utilize the abbreviation if it is frequently used in the specific clinical setting, assuming other providers will understand its context. Option D. Select a less common but more specific abbreviation that is less likely to be misunderstood. Correct answer is C. Utilize the abbreviation if it is frequently used in the specific clinical setting, assuming other providers will understand its context. Explanation. Scenario analysis. This scenario presents a common challenge in medical scribing, ensuring accuracy and clarity in documentation while adhering to established medical terminology and abbreviations. The professional challenge lies in the potential for misinterpretation of abbreviation, which can lead to medical errors, patient harm, and regulatory noncompliance. The scribe must exercise careful judgment to select the most appropriate and unambiguous abbreviation, or to spell out terms when ambiguity exists, thereby upholding patient safety and the integrity of medical records. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by using abbreviations that are universally understood and recognized within the specified regulatory framework for medical scribing. This aligns with best professional practice, which emphasizes clear, concise, and accurate medical documentation. The use of standardized abbreviations reduces the risk of misinterpretation, ensuring that healthcare providers can readily understand the patient's medical information. This practice is implicitly supported by guidelines that promote accurate record keeping and effective communication within the healthcare team, as mandated by professional certification standards. Incorrect approaches analysis. One incorrect approach involves using an abbreviation that, while common in some informal settings, is not universally recognized or is prone to misinterpretation within the formal medical record. This creates ambiguity and increases the risk of diagnostic or treatment errors, violating the scribe's ethical duty to maintain accurate records and the regulatory requirement for clear communication. Another incorrect approach is to use an abbreviation that is explicitly discouraged or prohibited by the certification body or relevant healthcare regulations due to its potential for confusion. This directly contravenes established guidelines and professional standards, leading to a failure in documentation integrity. A third incorrect approach is to consistently avoid all abbreviations, even those that are standard and widely accepted, thereby creating unnecessarily lengthy and potentially less efficient documentation. While seemingly safe, this can hinder efficient communication and is not in line with the accepted practices that allow for the judicious use of standardized abbreviations to improve clarity and conciseness. Professional reasoning. Professionals should adopt a decision-making process that involves first consulting the official list of approved abbreviations provided by the Apprentice Medical Scribe professional certification body or relevant regulatory guidelines. If an abbreviation is not on the approved list, or if there is any doubt about its clarity or universal understanding, the scribe should err on the side of caution and spell out the term in full. This systematic approach ensures that documentation is both accurate and compliant, prioritizing patient safety and professional integrity. Question 12. The control framework reveals that an apprentice medical scribe has completed the initial draft of a patient's discharge summary based on the supervising physician's dictation. Upon reviewing the electronic health record, (EHR), to verify factual accuracy, the scribe notices a discrepancy between a medication dosage listed in the dictation and the dosage recorded in the patient's active medication list within the EHR. The scribe also observes that a critical follow-up appointment mentioned in the dictation is not clearly scheduled in the patient's calendar within the EHR. What is the most appropriate course of action for the apprentice medical scribe? Option A. Independently adjust the medication dosage in the discharge summary to match the EHR and add a note about the follow-up appointment scheduling status. Option B. Highlight the medication dosage discrepancy and the unclear follow-up appointment status to the supervising physician for their review and instruction before finalizing the summary. Option C. Proceed with submitting the discharge summary as dictated by the physician without any modifications or further inquiry. Option D. Remove the medication dosage entirely from the discharge summary due to the discrepancy and leave the follow-up appointment section blank. The correct answer is A. Independently adjust the medication dosage in the discharge summary to match the EHR and add a note about the follow-up appointment scheduling status. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to balance the immediate need for accurate patient information with the strict regulatory requirements for documentation, specifically concerning discharge summaries. The challenge lies in ensuring completeness and accuracy without introducing personal interpretation or information not directly provided by the supervising physician. The scribe must understand the critical role of the discharge summary in continuity of care and patient safety, and the legal and ethical implications of any inaccuracies or omissions. Correct approach analysis. The correct approach involves diligently reviewing the physician's dictated or written discharge summary, cross-referencing it with the patient's electronic health record (EHR) for factual accuracy, e.g., dates, medication names, dosages, test results, and then presenting any discrepancies or missing critical information to the supervising physician for clarification and correction. This represents best professional practice because it adheres to the core principles of medical documentation: accuracy, completeness, and physician oversight. Specifically, it aligns with the regulatory framework for medical records, which mandates that all entries are factual, timely, and attributable to the ordering or treating physician. The scribe's role is to facilitate accurate documentation, not to create it independently. This approach ensures that the discharge summary is a reliable document for subsequent care providers and the patient, minimizing the risk of medical errors due to misinformation. Incorrect approaches analysis. One incorrect approach involves the scribe independently adding information to the discharge summary that was not explicitly dictated or documented by the physician, even if the scribe believes it is implied or necessary for clarity. This is a regulatory and ethical failure because it constitutes unauthorized practice and can lead to the introduction of inaccurate or misleading information into the patient's permanent record. The scribe is not authorized to interpret clinical data or make clinical judgments. Another incorrect approach is to simply transcribe the physician's dictation without any review or verification against the EHR, even if the scribe suspects inaccuracies or omissions. This fails to uphold the scribe's responsibility to ensure the accuracy and completeness of the record, potentially leading to patient harm and violating guidelines that emphasize the importance of accurate medical documentation for continuity of care. A third incorrect approach is to delay the completion of the discharge summary due to minor perceived ambiguities, without seeking prompt clarification from the physician. This can impede timely patient follow-up and care coordination, which is a critical function of the discharge summary and a potential violation of healthcare efficiency standards. Professional reasoning. Professionals should employ a structured decision-making framework when handling discharge summaries. This framework begins with understanding the purpose and regulatory requirements of the document. Next, Scribe must meticulously review the provided information against the patient's record, identifying any factual discrepancies or missing essential elements. The critical step is to then communicate these findings clearly and concisely to the supervising physician, seeking their direction for correction or addition. This process emphasizes collaboration, accuracy, and adherence to established protocols, ensuring that the final document is both compliant and clinically sound. The scribe's role is that of a diligent assistant, ensuring the integrity of the physician's documentation. Question 13. The performance metrics show a slight increase in the speed of chart completion, but a review of recent documentation reveals inconsistent use of abbreviations. A physician dictated a note that included the phrase PTC/OSOB, and the Apprentice medical scribe documented it as patient complaining of shortness of breath. However, in another instance, the scribe documented PTC/OCP as chest pain. Which of the following approaches best reflects adherence to professional standards and regulatory guidelines for abbreviation usage? Option A. Document abbreviations as they are heard in dictation, assuming the physician is using standard medical terminology. Option B. Employ personal shorthand or create new abbreviations that are understood by the supervising physician to expedite documentation. Option C. Use only abbreviations that are explicitly listed as approved by the institution, and write out terms when an abbreviation is not on the approved list or has multiple potential meanings. Option D. Utilize abbreviations that are commonly understood within the specific department, even if they are not formally approved, to maintain efficiency. The correct answer is C. Use only abbreviations that are explicitly listed as approved by the institution, and write out terms when an abbreviation is not on the approved list or has multiple potential meanings. Explanation. Scenario analysis. This scenario presents a common challenge in medical documentation, where the efficiency gained from using abbreviations must be balanced against the critical need for clarity and accuracy to prevent patient harm. The professional challenge lies in adhering to established guidelines, while ensuring that the shorthand used is universally understood within the healthcare setting and does not introduce ambiguity. Misinterpretation of abbreviations can lead to incorrect diagnoses, medication errors, or inappropriate treatment plans, directly impacting patient safety and the integrity of the medical record. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by adhering to the established list of approved abbreviations. This aligns with the core principles of medical documentation, which mandate accuracy, completeness, and clarity. By using only approved abbreviations, the scribe ensures that the information is readily understood by all members of the healthcare team, minimizing the risk of misinterpretation. This practice is often mandated by institutional policies and professional certification standards designed to uphold the quality and reliability of medical records, thereby preventing adverse events and ensuring continuity of care. Incorrect approaches analysis. Using an abbreviation not present on the approved list, even if commonly understood in a specific department, poses a significant risk. This violates the principle of standardized documentation and can lead to misinterpretation by clinicians outside that specific department or by future readers of the chart. This failure can be considered a breach of professional responsibility and potentially a violation of institutional policy regarding documentation standards. Employing an abbreviation that has multiple meanings without further clarification introduces ambiguity. This directly compromises the clarity of the medical record, a fundamental requirement for safe patient care. The potential for misinterpretation is high, which could lead to serious medical errors. This approach demonstrates a lack of diligence in ensuring the unambiguous communication of patient information, a critical ethical and professional failing. Relying on personal shorthand or newly created abbreviations, even if understood by the immediate physician, is unacceptable. Medical records are legal documents and are accessed by numerous healthcare professionals over time. Personal shorthand is not universally understood and creates a significant risk of misinterpretation, undermining the integrity and legal defensibility of the record. This practice directly contravenes the need for standardized, clear, and accessible medical documentation. Professional reasoning. Professionals should always consult and strictly adhere to the institution's approved abbreviation list. When in doubt about an abbreviation's meaning or approval status, the safest and most professional course of action is to write out the full term. This ensures clarity, accuracy, and compliance with regulatory and ethical standards for medical documentation, prioritizing patient safety above all else. Question 14. The monitoring system demonstrates that a physician has dictated a diagnosis for a patient that includes terminology the apprentice medical scribe finds potentially stigmatizing and may lead to misinterpretation by non-medical personnel. The apprentice scribe is concerned about the patient's privacy and the potential for negative judgment if the record is accessed inappropriately. What is the most appropriate course of action for the apprentice medical scribe in this situation? Option A. Rephrase the physician's dictated terminology to something less stigmatizing or more easily understood by a layperson. Option B. Document the physician's dictated terminology precisely as it was stated, without alteration or interpretation. Option C. Add a personal note to the record explaining the potential stigma associated with the dictated terminology. Option D. Omit the terminology from the medical record due to its potentially negative connotations. The correct answer is B. Document the physician's dictated terminology precisely as it was stated, without alteration or interpretation. Explanation. Scenario analysis. This scenario presents an ethical dilemma for an apprentice medical scribe concerning patient privacy and the accurate documentation of sensitive medical information. The challenge lies in balancing the need to record a patient's condition accurately with the ethical obligation to protect their confidentiality and avoid misinterpretation or stigmatization. The scribe must navigate the potential for bias or misjudgment when encountering a condition that might be perceived negatively by others, while also ensuring the medical record is complete and reflects the physician's findings. Correct approach analysis. The correct approach involves meticulously documenting the physician's dictated terminology without alteration or interpretation. This aligns with professional best practices and regulatory requirements for medical record keeping, such as those likely governed by HIPAA in the U.S. The scribe's role is to be a conduit for accurate transcription, not a medical interpreter or judge. By using the exact terminology provided by the physician, the scribe ensures the integrity of the medical record, respects patient confidentiality by not adding personal commentary, and avoids introducing potential errors or biases. This adheres to the principle of fidelity in patient care and upholds the scribe's professional responsibilities. Incorrect approach is analysis. One incorrect approach would be to alter the physician's terminology to something perceived as less stigmatizing or more easily understood by a layperson. This is a regulatory and ethical failure because it constitutes unauthorized modification of medical documentation, potentially leading to misdiagnosis, incorrect treatment, or legal ramifications. It violates the principle of accuracy and fidelity in record keeping. Another incorrect approach would be to omit the terminology altogether due to discomfort or a perceived negative connotation. This is a significant ethical and regulatory failure. It compromises the completeness of the patient's medical record, which is crucial for continuity of care and accurate medical decision-making. It also breaches the scribe's duty to accurately reflect the physician's findings. A third incorrect approach would be to add personal interpretations or subjective observations to the dictated terminology. This is a clear violation of professional boundaries and ethical conduct. The scribe is not qualified to interpret or add to the physician's diagnosis. Such actions can introduce bias, misinformation, and legal liability, undermining the trust placed in the medical record and the healthcare team. Professional reasoning. Professionals in this situation should follow a clear decision-making process. 1. Prioritize accurate transcription of the physician's exact words. 2. If unsure about terminology, seek immediate clarification from the physician. 3. Never alter, omit, or interpret dictated information. 4. Adhere strictly to established privacy and documentation policies. 5. Maintain professional detachment and focus solely on the task of accurate record keeping. Question 15. Operational review demonstrates that an apprentice medical scribe, when faced with an unfamiliar medical abbreviation during a patient encounter, has been relying on a personal, unverified list compiled from various online sources and has occasionally inferred the meaning based on the surrounding clinical context without direct physician confirmation. Which of the following actions best aligns with regulatory requirements and professional best practices for medical scribes? Option A. Document the encounter without the unfamiliar abbreviation, leaving a blank space or a note indicating uncertainty to avoid potential transcription errors. Option B. Strictly adhere to the healthcare organization's approved and current list of medical abbreviations, and when an abbreviation is not found or is ambiguous, immediately seek clarification from the supervising physician or designated clinical staff. Option C. Continue to use a personal, unverified list of abbreviations, supplementing it with contextual inference, as this demonstrates initiative and efficiency in documentation. Option D. Assume the meaning of unfamiliar abbreviations based on common usage found in general medical literature, as this reflects a broad understanding of medical terminology. The correct answer is B. Strictly adhere to the healthcare organization's approved and current list of medical abbreviations, and when an abbreviation is not found or is ambiguous, immediately seek clarification from the supervising physician or designated clinical staff. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate medical documentation. Misinterpreting or misusing medical abbreviations can lead to significant patient safety risks, including incorrect diagnoses, inappropriate treatments, and medication errors. The apprentice scribe's reliance on an outdated or incomplete list, coupled with a lack of immediate clarification, highlights a vulnerability in the documentation process that requires rigorous adherence to established protocols and continuous learning. The professional challenge lies in ensuring that all scribes are equipped with current, accurate information and possess the judgment to seek clarification when in doubt, thereby upholding the integrity of patient records. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance, adhering strictly to the organization's approved list of medical abbreviations and acronyms, and actively seeking clarification from a supervising physician or designated clinical staff when encountering an unfamiliar or ambiguous abbreviation, directly aligns with the core principles of accurate medical record keeping. This proactive stance mitigates the risk of documentation errors, which could have severe consequences for patient care. Furthermore, it demonstrates a commitment to professional development and adherence to established organizational policies, which are often informed by regulatory requirements aimed at ensuring quality and safety in healthcare. Incorrect approaches analysis. Using an outdated or personal list of abbreviations is a direct violation of organizational policy and potentially regulatory guidelines that mandate accurate and standardized documentation. This approach introduces a high risk of misinterpretation, as abbreviations can have multiple meanings or evolve over time. It fails to ensure consistency and accuracy in the medical record, which is a fundamental ethical and professional obligation. Assuming the meaning of an unfamiliar abbreviation based on context alone, without verification, is a dangerous practice. While context can be helpful, it is not a substitute for definitive understanding. This can lead to the transcription of incorrect information, directly impacting patient care and potentially leading to adverse events. This failure to verify critical information breaches the duty of care owed to the patient and undermines the reliability of the medical record. Failing to document an abbreviation altogether when its meaning is unclear or leaving a blank space is also an unacceptable approach. While it avoids transcribing incorrect information, it leaves the medical record incomplete and potentially ambiguous. This can hinder subsequent healthcare providers' understanding of the patient's condition or treatment, thereby compromising continuity of care. It also represents a failure to fulfill the scribe's primary responsibility of accurately and comprehensively documenting the encounter. Professional reasoning. Professionals in this role must adopt a decision-making process that centers on accuracy, verification, and adherence to established protocols. When encountering medical abbreviations, the primary steps should be: 1. Consult the organization's official, up-to-date list of approved abbreviations. 2. If the abbreviation is not found or is ambiguous, immediately seek clarification from the supervising physician or a designated clinical authority. 3. Document the abbreviation accurately as provided or clarified. 4. If clarification is not immediately available and the abbreviation is critical to the documentation, note the ambiguity and follow up as soon as possible. This systematic approach ensures that all documentation is precise, reliable, and compliant with professional standards and regulatory expectations. Question 16. The risk matrix shows a moderate likelihood of documentation errors related to the interpretation of complex pathophysiological processes in patients presenting with acute respiratory distress. A patient presents with sudden onset dyspnea, chest tightness, and wheezing. The attending physician notes findings consistent with bronchospasm and orders bronchodilator therapy. Which of the following approaches best optimizes the scribe's documentation process to mitigate this risk? Option A. Documenting the patient's symptoms and the physician's order for bronchodilator therapy, while also researching and adding potential differential diagnoses for acute respiratory distress. Option B. Documenting the patient's symptoms, the physician's assessment of bronchospasm, and the underlying pathophysiological mechanism of airway smooth muscle contraction leading to reduced airflow. Option C. Documenting the patient's reported symptoms of dyspnea, chest tightness, and wheezing, and noting the physician's order for bronchodilator therapy. Option D. Documenting the patient's symptoms and the physician's diagnosis of bronchospasm, along with a brief explanation of how bronchodilators work to alleviate airway constriction. The correct answer is C. Documenting the patient's reported symptoms of dyspnea, chest tightness, and wheezing, and noting the physician's order for bronchodilator therapy. Explanation. This scenario is professionally challenging because it requires an apprentice medical scribe to interpret complex pathophysiological information and translate it into accurate and actionable documentation within a high-pressure clinical environment. The scribe's role is critical in ensuring clear communication between healthcare providers, which directly impacts patient care and safety. Misinterpreting or inaccurately documenting pathophysiological processes can lead to diagnostic errors, inappropriate treatment plans, and adverse patient outcomes. Careful judgment is required to distinguish between subtle variations in disease presentation and to ensure that the documented information aligns with the clinician's assessment and the patient's clinical picture. The correct approach represents best professional practice because it prioritizes accurate and comprehensive documentation of the patient's presenting condition and the clinician's diagnostic reasoning. This aligns with the core ethical and professional responsibilities of a medical scribe, which include maintaining patient confidentiality, ensuring accuracy in documentation, and supporting efficient clinical workflows. By focusing on the underlying pathophysiological mechanisms contributing to the patient's symptoms, the scribe provides a more complete and clinically relevant record. This detailed documentation aids in continuity of care, facilitates future clinical decision-making, and is essential for regulatory compliance, particularly concerning the accuracy and completeness of the medical record as mandated by healthcare regulations. An incorrect approach that focuses solely on symptom reporting without delving into the underlying pathophysiology fails to capture the full clinical picture. This can lead to a superficial understanding of the patient's condition, potentially hindering effective treatment. Ethically, this approach could be seen as a failure to provide a complete and accurate medical record, which is a fundamental requirement. Another incorrect approach that involves making independent diagnostic interpretations or suggesting diagnoses not explicitly stated by the clinician is a significant regulatory and ethical failure. Scribes are not licensed to diagnose. Their role is to document the clinician's findings and orders. Such actions constitute practicing medicine without a license, violating professional boundaries, and potentially introducing errors into the patient's record. This also breaches patient trust and could have legal ramifications. Professional decision-making in such situations should involve a systematic process. First, actively listen to and observe the clinician's assessment and the patient's presentation. Second, identify key symptoms and signs that point towards specific pathophysiological processes. Third, consult reliable medical resources, as permitted by the scribe's scope of practice and facility policy, to understand the pathophysiology behind these symptoms. Fourth, accurately and concisely document the clinician's interpretation of these pathophysiological processes and their impact on the patient's condition, using precise medical terminology. Finally, if there is any ambiguity or uncertainty, the scribe should seek clarification from the supervising clinician, rather than making assumptions or independent judgments. Question 17. The performance metrics show a slight increase in the average time taken per patient encounter for documentation, particularly in cases involving complex anatomical descriptions. A new apprentice scribe is consistently documenting findings related to the musculoskeletal system, but their descriptions sometimes deviate from standard anatomical terminology when encountering less common presentations, opting instead for more generalized terms. This apprentice also tends to omit specific measurements or positional details if they are not immediately obvious or if the physician's dictation is brief. Which approach best reflects the apprentice's professional responsibility in this situation, considering the need for accurate anatomical documentation and adherence to regulatory guidelines for medical records. Option A. Document anatomical findings as best as possible with available knowledge, and only seek clarification if the physician explicitly states there is a significant deviation from the norm, otherwise proceeding with generalized descriptions. Option B. Document anatomical findings using precise, standard terminology, seeking immediate clarification from the supervising physician for any ambiguities or unusual presentations, and ensuring all specific measurements and positional details are accurately transcribed as dictated. Option C. Prioritize speed by using generalized anatomical terms when specific ones are difficult to recall or articulate, and omit measurements or positional details that are not explicitly emphasized by the physician to maintain efficiency. Option D. Assume common anatomical variations when descriptions are unclear and document based on these assumptions to expedite the charting process, as performance metrics are a key indicator of success. The correct answer is B. Document anatomical findings using precise, standard terminology, seeking immediate clarification from the supervising physician for any ambiguities or unusual presentations, and ensuring all specific measurements and positional details are accurately transcribed as dictated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to balance the need for accurate and efficient documentation with the fundamental ethical and regulatory obligation to protect patient privacy and ensure the integrity of medical records. Misinterpreting or misrepresenting anatomical information can lead to diagnostic errors, inappropriate treatment, and patient harm, all of which have significant legal and professional repercussions. The pressure to meet performance metrics can create a temptation to cut corners, which is precisely where professional judgment and adherence to regulatory frameworks become critical. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing accuracy and patient safety above all else. It involves a thorough understanding of anatomy and physiology, enabling the scribe to correctly interpret and document findings. This aligns with the core principles of medical documentation, which mandate that all entries be accurate, complete, and timely. Furthermore, it upholds the regulatory requirement for precise medical record keeping, preventing potential misinterpretations by other healthcare professionals. This approach ensures that the medical record serves its intended purpose as a reliable tool for patient care and legal accountability. Incorrect approaches analysis. One incorrect approach involves assuming a common anatomical variation without explicit confirmation from the supervising physician. This is a regulatory and ethical failure because it introduces speculation into the medical record, which must be based on objective findings and physician dictation. It violates the principle of accuracy and can lead to misdiagnosis or inappropriate treatment plans, potentially resulting in patient harm and malpractice claims. Another incorrect approach is to document a finding based on a general understanding of anatomy, even if the physician's description is ambiguous or suggests an unusual presentation. This fails to meet the standard of meticulous documentation required by regulations. Ambiguity in the record can lead to confusion and errors in subsequent care, and it does not reflect the physician's specific observations, thus compromising the integrity of the patient's chart. A third incorrect approach is to omit details about an anatomical finding because they seem minor or are difficult to articulate precisely. This is a failure to ensure completeness of the medical record, a key regulatory requirement. Even seemingly minor anatomical details can be clinically significant, and their omission can hinder a comprehensive understanding of the patient's condition, leading to potential diagnostic oversights. Professional reasoning. Professionals should approach anatomical documentation with a commitment to accuracy, clarity, and adherence to physician dictation. When faced with ambiguity or uncertainty regarding anatomical descriptions, the primary decision-making step is to seek immediate clarification from the supervising physician. This ensures that the documentation accurately reflects the physician's assessment and avoids introducing errors. Professionals must also be aware of the specific regulatory requirements for medical record keeping within their jurisdiction, which emphasize accuracy, completeness, and patient privacy. A systematic approach involving active listening, precise transcription, and proactive clarification is essential for maintaining high standards of care and professional integrity. Question 18. Stakeholder feedback indicates that a recent patient encounter's medical record, as transcribed by an apprentice medical scribe, contains several factual inaccuracies and significant omissions regarding the patient's reported symptoms and the physician's examination findings. The scribe has identified these discrepancies after the physician has left the immediate vicinity. What is the most appropriate immediate course of action for the apprentice medical scribe? Option A. Make the necessary corrections to the record independently without informing the supervising physician to ensure accuracy. Option B. Document the information exactly as it was verbally communicated during the encounter, assuming the physician will review and correct it later. Option C. Immediately notify the supervising physician of the identified inaccuracies and omissions and work with them to correct the record before it is finalized. Option D. Wait for the supervising physician to discover the errors during their review and then address them. The correct answer is C. Immediately notify the supervising physician of the identified inaccuracies and omissions and work with them to correct the record before it is finalized. Explanation. Scenario analysis. This scenario is professionally challenging because it directly impacts patient care and legal compliance. Inaccurate or incomplete medical documentation can lead to misdiagnosis, inappropriate treatment, medication errors, and adverse patient outcomes. Furthermore, it can create significant legal liabilities for the healthcare provider and the scribe, as well as hinder effective communication among the healthcare team. The scribe's role in ensuring the accuracy and completeness of the medical record is therefore paramount. Correct approach analysis. The correct approach prioritizes immediate and thorough correction of the identified inaccuracies and omissions. This aligns with the core ethical and professional responsibilities of a medical scribe, which include maintaining the integrity of the medical record. Regulatory frameworks, such as those governing patient privacy and the accuracy of medical documentation, e.g., HIPAA in the U.S., which mandates accurate and complete records, underscore the importance of this diligence. By proactively addressing the errors, the scribe upholds the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. This also demonstrates accountability and a commitment to quality patient care, which are fundamental to professional practice. Incorrect approaches analysis. Failing to report the inaccuracies and omissions to the supervising physician is a direct violation of professional duty and potentially regulatory requirements. It allows erroneous information to persist in the patient's record, increasing the risk of patient harm and creating a false representation of the patient's condition and care. This constitutes a failure to uphold the principle of veracity, truthfulness, and can lead to legal repercussions for both the scribe and the physician. Documenting the information as it was verbally communicated, despite knowing it is inaccurate or incomplete, is a severe ethical breach. It prioritizes expediency over accuracy, directly contributing to a compromised medical record. This action undermines the trust placed in the scribe and can have devastating consequences for patient safety. It also violates the implicit agreement to accurately reflect the clinical encounter. Waiting for the physician to discover the errors before making corrections is a passive and irresponsible approach. It abdicates the scribe's responsibility to ensure the integrity of the record from the outset. This delay increases the window of opportunity for patient harm and can be interpreted as negligence. It fails to demonstrate the proactive diligence expected of a professional in this role. Professional reasoning. Professionals in this situation should employ a decision-making process that prioritizes patient safety and regulatory compliance. This involves 1. Recognizing the potential impact of the inaccuracy or omission on patient care and legal standing. 2. Understanding the scribe's ethical and professional obligation to ensure the accuracy and completeness of the medical record. 3. Immediately and clearly communicating the identified issues to the supervising physician, providing specific details of the inaccuracies and omissions. 4. collaborating with the physician to implement the necessary corrections in a timely and documented manner. This systematic approach ensures that all parties are aware of the situation and that the medical record is rectified, thereby protecting the patient and adhering to professional standards. Question 19. The efficiency study reveals that an apprentice medical scribe is documenting a patient presenting with shortness of breath and chest pain. The scribe observes the patient's labored breathing and notes a pale complexion. While reviewing the patient's chart, the scribe sees a history of hypertension and hyperlipidemia. Based on this information, which of the following represents the most appropriate action for the apprentice medical scribe? Option A. Record the patient's subjective complaints of shortness of breath and chest pain as definitive symptoms of a specific cardiac condition without physician confirmation. Option B. Document a suspected diagnosis of myocardial infarction based on the observed symptoms and patient history. Option C. Document the observed signs and symptoms accurately, including the patient's medical history as provided in the chart, and await physician assessment and diagnosis. Option D. Suggest to the physician that the patient's shortness of breath and pallor are likely indicative of an acute cardiac event, and recommend immediate cardiac workup. The correct answer is C. Document the observed signs and symptoms accurately, including the patient's medical history as provided in the chart, and await physician assessment and diagnosis. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the apprentice medical scribe to interpret complex clinical information and assess its potential impact on patient care without overstepping their defined role. The scribe must balance the need to accurately document patient conditions with the ethical and regulatory boundaries of their position, particularly concerning diagnostic interpretation and treatment recommendations. Misinterpreting disease processes or their systemic effects can lead to inaccurate documentation, which in turn can affect clinical decision-making and patient safety. The pressure to be efficient, as highlighted by the efficiency study, can exacerbate this challenge, potentially leading to rushed judgments. Correct approach analysis. The correct approach involves recognizing the limitations of the scribe's role and focusing on accurate, objective documentation of observed signs, symptoms, and physician-diagnosed conditions. This aligns with professional ethical guidelines and regulatory frameworks that define the scribe's scope of practice. Specifically, it upholds the principle of patient confidentiality and data integrity by ensuring that documentation is factual and based on direct observation or physician input, rather than speculative interpretation. This approach minimizes the risk of diagnostic error or misrepresentation, which could have serious consequences for patient care and legal liability. It also respects the physician's ultimate responsibility for diagnosis and treatment planning. Incorrect approach is analysis. One incorrect approach involves attempting to diagnose or predict the progression of a disease process based on observed symptoms. This is a direct violation of the scribe's scope of practice. Regulatory frameworks for medical scribes strictly prohibit them from making medical diagnoses or offering medical advice. Such an action constitutes a breach of professional conduct and could lead to patient harm if the scribe's interpretation is incorrect. It also undermines the authority and responsibility of the licensed healthcare provider. Another incorrect approach is to document subjective interpretations of a patient's condition as objective facts. For example, stating a patient appears to be experiencing severe pain without direct physician confirmation or specific objective findings, like grimacing, guarding, or vital sign changes documented by the physician, is speculative. This introduces bias into the medical record, compromising its accuracy and reliability. Ethical guidelines mandate that medical records be factual and objective. A further incorrect approach is to suggest or document potential treatment modifications based on the scribe's understanding of the disease process. This directly encroaches upon the physician's role and responsibilities. Regulatory bodies and professional standards emphasize that scribes are support staff and do not have the authority to influence or direct patient care decisions. Such actions could lead to inappropriate medical interventions and are a serious ethical and regulatory breach. Professional reasoning. Professionals in this role should employ a decision-making process that prioritizes accuracy, objectivity, and adherence to scope of practice. This involves a continuous self-assessment of their actions against established guidelines. When faced with ambiguity or complex clinical information, scribes should default to documenting observable facts and deferring interpretation and diagnostic conclusions to the physician. This systematic approach ensures that the medical record remains a reliable tool for patient care, and that the scribe operates within legal and ethical boundaries. The core principle is to support the physician's work through accurate and efficient documentation, not to participate in medical decision-making. Question 20. Governance review demonstrates that a patient presents with a history of intermittent chest tightness and occasional shortness of breath. During the physical examination, the physician notes clear lung sounds and no audible murmurs. The patient denies any recent cough or fever. Which of the following approaches best reflects the required documentation standards for an apprentice medical scribe professional certification, ensuring accuracy across multiple body systems? Option A. Document the patient's reported chest tightness and shortness of breath, along with the physician's findings of clear lung sounds and no murmurs, and explicitly note the patient's denial of cough and fever. Option B. Combine the patient's reported symptoms and the physician's findings into a single statement, such as patient reports chest tightness and shortness of breath, but lungs are clear. Option C. Omit documentation of the patient's denial of cough and fever, as these were negative findings and not the primary complaints. Option D. Document only the physician's objective findings of clear lung sounds and no murmurs, as these are considered more definitive than subjective patient reports. The correct answer is A. Document the patient's reported chest tightness and shortness of breath, along with the physician's findings of clear lung sounds and no murmurs, and explicitly note the patient's denial of cough and fever. Explanation. Scenario analysis. This scenario presents a common challenge in medical documentation where a scribe must accurately capture patient information across multiple body systems, even when presented with potentially conflicting or incomplete data. The professional challenge lies in ensuring the integrity and accuracy of the medical record, which directly impacts patient care, billing, and legal compliance. The scribe must exercise careful judgment to synthesize information, identify potential discrepancies, and document findings in a way that is both comprehensive and clinically relevant, adhering strictly to the established regulatory framework for medical scribes. Correct approach analysis. The correct approach involves meticulously documenting the patient's reported symptoms and the physician's objective findings for each relevant body system. This includes noting the absence of certain symptoms if explicitly stated by the patient or physician, and clearly distinguishing between subjective patient reports and objective physical examination results. This method ensures that the medical record is a faithful representation of the encounter, adhering to the principles of accurate medical charting and the specific guidelines of the Apprentice Medical Scribe Professional Certification, which emphasize precision and clarity in documenting patient data across all body systems. Incorrect approaches analysis. One incorrect approach is to omit documentation of symptoms that were explicitly denied by the patient, even if the physician's examination findings might suggest otherwise. This failure to record patient-reported negatives can lead to an incomplete picture of the patient's presentation and may mislead future clinicians. It violates the ethical obligation to document all pertinent information, both positive and negative, as reported by the patient or observed by the physician. Another incorrect approach is to assume the physician's examination findings supersede the patient's reported symptoms without explicit clarification. For instance, if a patient reports shortness of breath, but the physician's exam notes clear lungs, the scribe should document both the patient's report and the physician's findings separately, rather than solely documenting the exam findings. This omission of subjective data can create a false impression of the patient's experience and may not align with the regulatory requirements for comprehensive charting. A further incorrect approach is to combine subjective patient reports and objective physician findings into a single, undifferentiated statement. For example, stating patient has chest pain and lungs are clear, without clearly attributing each piece of information. This lack of distinction blurs the line between what the patient feels and what the physician observes, compromising the accuracy and utility of the medical record, and failing to meet the standards of precise medical documentation. Professional reasoning. Professionals should approach this situation by prioritizing accuracy and clarity in documentation. The decision-making process involves 1. Actively listening to and recording both patient-reported symptoms and physician observations for each body system. 2. Clearly differentiating between subjective patient-reported and objective physician-observed data. 3. Documenting all pertinent information, including the absence of symptoms if explicitly stated. 4. seeking clarification from the physician if there are apparent contradictions or ambiguities. 5. Adhering strictly to the Apprentice Medical Scribe professional certifications guidelines for accurate and comprehensive medical record keeping.